I came because I wanted to learn as much as I could, and I particularly wanted to learn about the process. I wanted to learn how things were done in Washington, how did the administration interface with Congress, what role did the judiciary have. I was very interested in the total flow of process.
Prior to the fellowship, my work had mostly been clinical and also operational on sort of the receiving end of policy. And I was really interested in seeing what it's like to maybe be on the other side and help to set up some of the parameters and the programs for the way healthcare plays out in our country.
As I applied, I remember my interview on a very cold January day in Washington in 1980, and was interviewed by a pediatrician named Maggie Mahoney. And she was my first interview, and she said, "So, Krugman, what do you want to do this for?" And I guess I answered okay. I said, I've been involved a lot in state politics. I set up a rural health program throughout Colorado, and I've been involved with the Human Services Department, and particularly the workforce issues for a long time. I'm just interested in learning more about federal policy.
I work in health data analytics and policy. I programmed to get in because I didn't think they would ever let me in because I'm not an academic and I'm not a doctor. I want to learn what I don't know. These are the things I do know. I function in the state, sphere. I don't know the details and the ins and outs at the federal level, and so I'm looking to learn what I don't know. And then when I actually got the notification that I was in the program, was dumbfounded and utterly perplexed because I didn't think program, and I had made zero plans. I had no plans to take a sabbatical. My company didn't give sabbaticals. I had no idea how to move to DC. So it was a little bit backwards because I really didn't think with my program.
Before I was a fellow, I was a public health pediatrician. And pediatricians are crazy about prevention, and public health people are crazy about programs that improve the health of the public. So I was doing health policy at the state level. We had state providers who were ready to provide care, and they couldn't do it because the feds wouldn't change the law to allow mid-levels to do that care. So that was an example of the kind of legislation that showed me I did not know enough about federal policymaking or matching state and federal policy.
So I'm a nurse midwife from the Navajo Nation in New Mexico, and the work that I do has been around increasing access to maternal health care in New Mexico. And even though I was doing incredible, innovative work in my community, unless health policy is attached to it, it's not sustainable. So I wanted to understand how health policy works at a national level, and also how the U.S. government works with tribes and how they're involved in this process.
I think the reason for me doing this is the access to health services in general, but especially for primary care resources in the rural and the underserved parts. This served as a way for me to learn more about how I could be more effective in affecting policy.
I've been a researcher for years. I study how to move research evidence into community and clinical spaces that are outside of the hospital. And a lot of our efforts are difficult to sustain because we don't have policy mechanisms to keep them going. And so I realized that not knowing about policy was hindering the work that I was doing. And so I thought that this would be a great opportunity to figure out how research evidence informs policy, how you can build policy initiatives to actually pay for the kind of work that we want to do and sustain our efforts in community settings.
I was a happy data guy doing research, and Congress cut funding in half to an agency I was getting grants from, and I had never really spent a lot of time focused on policy. And I suddenly realized I better get smart really fast. Figure out how the And I went on my first Hill visit, and I realized two things. One is that the world of health policy was deliciously fascinating and complex, and I wanted to learn more. And the country was run by a bunch of 20-year-olds who cared what I had to say as an academic physician. And so I was smitten and decided to apply to the program.
My brother was an early AIDS and was very sick at the time that I was making my application. And here's a guy, he had worked all his life, he had a successful business, but when he sold his business, they didn't carry over his health insurance, and impoverished. My mother having to show up at the hospital with cash in hand before they would admit him and treat him. It was just like, are you kidding me? It was just amazing. So I was really motivated to try and understand, how things could do differently.
I am a HIV/AIDS practitioner, and I couldn't get my HIV patients the care that they needed because of insurance issues, and I realized that it was a policy issue. I didn't know enough about policy, so I came and I learned then to be able to go back to my community.